The Impacts of the COVID-19 Pandemic on Suicide Rates by Kaitlyn Eggert. The COVID-19 pandemic that gripped the globe from 2019 to 2021 had a profound effect on the psyche of many individuals. While there is no significant evidence of a rise in suicide during this time, there is no doubt that it played a role in the suicides and attempts that occurred. The main topics of this presentation are: what is COVID-19, the COVID-19 pandemic timeline, COVID-19 cases and deaths, risk factors for suicide, and prevention techniques. The purpose of this is to inform and raise awareness of loneliness and isolation and economic effects on the world during and following the COVID-19 disaster. What is COVID-19? COVID-19 is a virus first reported in late 2019 in Wuhan, China, that causes fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. Severe COVID-19 infections often require hospitalization and may result in acute respiratory distress syndrome, acute cardiac events, shock, and multi-organ failure. While most patients recover completely, a significant number have reported having continued symptoms of COVID long after the acute phase of the illness. There is also significant evidence indicating psychiatric issues of patients who experienced COVID-19. Some of the reported psychiatric illnesses include post-traumatic stress disorder, anxiety, depression, obsessive-compulsive disorder, and insomnia. This is the COVID-19 timeline. The first case of COVID was reported in Wuhan, China on December 31, 2019, and continued to rapidly spread across nearly 200 countries. On March 11, 2020, the World Health Organization declared it a global pandemic due to the severity of the virus and the rapid spread. As a result of the World Health Organization declaration, almost every country in the world responded by declaring public health measures, such as home confinement, school and business closures, and massive travel restrictions. The busy lives of billions of individuals suddenly came to a grinding halt. By April of 2020, more than 1/3 of the global population was under some sort of movement restriction. The World Health Organization came to express concern about the impacts of COVID-19 on mental health as well, estimating a 25% increase in prevalence of anxiety and depression worldwide. As the world was shutting down, the World Health Organization also sounded another alarm. We should be prepared for an increase in suicides due to social isolation, school and business closures, health service disruptions, and diminished economic activity. In prior pandemics, such as the Spanish flu epidemic from 1918 to 1920 in the United States and the 2003 SARS epidemic in Hong Kong, there was a surge of suicides. Would COVID be any different? COVID-19 cases and deaths. At the time of this writing, there are 697,643,111 reported COVID-19 cases and 6,937,333 deaths that have resulted globally because of COVID-19. The very height of the pandemic occurred on January 21, 2021, when the daily death rate from COVID-19 reached its pinnacle. 16,952 lives lost in a single day. While many consider the pandemic to be over, the date with the highest recorded number of new cases of COVID was January 20th, 2022, with an astounding 3,839,262 new cases of COVID. There are many risk factors for suicide that have arisen due to the pandemic lockdown. The risk factors are as follows: social isolation, school and business closures, health service disruptions, diminished or stalled economic activity, job loss, loneliness, pre-existing mental illnesses, burnout of frontline healthcare workers, being infected or suspected of infection of COVID-19, experiencing long COVID, increased household stress, drug and alcohol misuse, domestic violence, low accessibility of mental health services, financial strain, and misinformation spread about the pandemic and treatments for COVID-19. Here are some prevention techniques that we could use to prevent suicide in the future, particularly during challenging, vulnerable times such as pandemics, terrorist attacks, and natural disasters. Here are some of those preventative measures that could be taken. Staying connected through social media or online platforms and other apps, reducing unemployment, implement government financial assistance and debt relief, dispelling misinformation and rumors, early detection and timely intervention, diminished media reports involving suicide. In other words, do not include details of the suicide so as not to incite copycats. Ensuring ongoing psychiatric care is available via apps like Zoom, Microsoft Teams, Skype, FaceTime, and others. Reducing availability of lethal means such as pesticides, poisons, and firearms to those considered high risk for suicide. And most importantly, adequate availability of personal protective equipment and medical supplies, particularly to medical personnel as well as those with heightened worries about the pandemic and becoming ill. In conclusion, while there has been no significant evidence pointing to the COVID-19 pandemic directly impacting suicide rates, there is absolutely no doubt that the pandemic impacted billions of citizens around the world in varying ways. There were many challenges posed to groups looking to perform studies on suicide rates in COVID-19, so finding high-quality research in this area was difficult. The most important conclusion that we can come to is that whether we're all locked down in our homes due to a raging pandemic or we're out in the world going about our daily lives, it is important to be there for each other. Watch out for personality changes in our circle of friends and family. Reach out to check on our people and make sure they're okay. While in some cases there are no indications that someone may be thinking about suicide, there are typically subtle warning signs. Be nice to each other and be good to each other, always. Thank you.